Good evening and welcome to this episode of Family Matters. Tonight, our focus of discussion is on discordant couple. Most discordant couples end up separating because of so many complexities that come with the HIV positive status. This includes stigma, added responsibilities, and so forth. So how do you, as a couple or as a partner, ensure that you do not transmit the virus to your partner? Tonight, we are joined by Lilian Ndokwe, who is a HIV prevention nurse, and Martin Mbaya, who is a clinician. They will be helping us with our discussion. Unfortunately, our couple could not make it, but we will be continuing with Lilian and Mbaya. Welcome to the program, Lilian and Mbaya.
Thank you so much.
Yes, and it's nice to see you and to have you discuss matters discordancy. One of our viewers is already asking, who are these discordant couples? Maybe Martin, you could help our viewer understand what exactly discordancy is.
Yeah, thank you so much, Pretty, for having me in the show. And in a nutshell, discordancy is a situation where you find a couple, one of them, of the partners is HIV positive, and the other one is HIV negative, and they're living together. And the main issue here is that they are being intimate, they're getting intimate. So there is the issue of the intimacy, and then one partner being positive, HIV positive, the other one being HIV negative.
Right. And when you talk about one partner is positive and the other is negative, first, Lilian, make us understand, does it only apply to couples, people who are married, or even there is a discordant relationship?
First of all, I would like to thank you for having me here tonight. And we have discordant couples. Mostly we term them as discordant couples because these are people who are intimate, just as my colleague has just said. They are living together, they are married, and we also have relationships in that this is a girlfriend and a boyfriend. We also have such terms. We've seen them in our facilities. They come, the girlfriend is negative, the boyfriend is positive, and they still want to continue the relationship, maybe take it to a higher level to marriage. So yes, we have discordant couples, and also we have discordant relationships. We have seen them.
All right.
Yeah.
And a report by CDC, Martin, has revealed that over 260,000 couples right now are a discordant couple. What are the key factors that lead to discordancy? How do couples find themselves in such a situation or scenario?
Yeah, thank you very much for that question, because I think that will be the basis of our discussion tonight. Most importantly, it's good to know that discordancy is not a permanent situation. It can change anytime in most cases. We have a few people who may not get HIV because of genetical abnormality. When HIV is getting into the body, there are some receptor cells in the body that receive HIV. So if you have an abnormality in those cells, then you may not get infected. But that's a very small percentage of the population. But most of the other people that you're dealing with in a discordant relationship are discordant because, one, the partner is taking care of himself, basically in terms of taking ARVs, that if the positive partner is on ARVs, then the viral load is very low, and the chances of transmitting to the other person is negative is low. And also another thing is if the partner also is practicing safe sex, that is the use of condoms. And these days also in our country, we're really encouraging men, especially to go for circumcision, because male circumcision also decreases the chances of the male partner getting HIV. So as I said earlier, it's not, in most cases, it's not a permanent situation, and therefore it's very important that the positive partner understands that for the negative partner to continue being negative, then they are solely looking at the positive partner, and that the positive partner has to be on care and treatment, basically to prevent the infection to the negative person.
Yes, and Martin, let me stay with you. Let's talk about the so many myths that are there that are associated with discordancy. When, for instance, you are living as a couple and one person turns out to be positive or with the virus, then the issue of unfaithfulness, the issue of, maybe you could just remind our viewers, what are some ways of HIV prevention because it can be necessary, it can be necessarily not really as a result of unfaithfulness. Apart from sexually transmission way of contracting HIV and AIDS, what are other possible ways in which one can accidentally, if I may say so, contract the disease?
Yeah, as you say, there are so many myths about how HIV is transmitted. And the commonest one is about sharing utensils, maybe, and also kissing. But those have not been proven to transmit HIV. There are ways that are known to transmit HIV, and one of them, of course, is through intimacy, through sex. And then the other one is situations where you find that there is exchange of body fluids. So let's say, for example, in an accident situation, that you may probably be seated with someone who knows their status, and then during that accident there is exchange of blood, and a person may get infected that way. Another way also is about blood transfusions, but again, that's really doesn't contribute a lot, because again, blood is screened a lot before it's given to the patients. But it's a way that has been shown to transmit HIV, and I think those are the two main ones that may contribute to getting an infection. And just to add to that, because most of the cases of HIV transmission are usually due to intimacy, there are quite a number of other factors that play in, because we know the more the frequency, the more the risk, And another factor also is that if the person who is HIV negative is suffering from other illnesses, especially sexually transmitted infections. And for this case, there is one called herpes simplex that is really key. Most times we will find if someone has herpes simplex, especially the negative partner, and the positive partner, they get intimate, then there is an increased chance that this person who is negative will get HIV from the positive partner.
Right.
And I would also like to add on just what Macha said. We also have this vertical transmission whereby this baby gets transmitted from their, maybe during breastfeeding or during delivery, and these kids grow up to, we find them, they grow up to even the age of getting married or getting intimate. So I wouldn't advise for maybe the partner to blame the partner is positive on unfaithfulness or something like maybe you are careless and you got the transmission. Some people grow up with this infection from an early age. They got transmission from their parents, and they get up to this age of getting married. They need to get intimate. It's a life cycle. And basically, those are the ways of transmission for HIV transmission.
Yeah. And Lillian, tell us why it's important, especially for a couple, because most people say as long as I am faithful to my partner and I am very sure that my partner is faithful to me. But tell us why it's important for a couple to have this regular HIV testing.
First of all, I don't want to sound biased, but most of the families together, the man really dwells on the wife's status. Like my wife was tested, she was pregnant the other day, she's negative, I'm also negative. This brings about the issue of discordance. You might find that your wife is negative, but the one who is positive. And it's not a permanent status. You might infect the wife and maybe she's breastfeeding or something. So it's important, even as they go to hospitals, we encourage that they come with their partners because they are fast-tracked. When you come with your husband, you don't queue for long. That is a plus, because we encourage men to come and get tested. And let's not dwell so much on our wives' status. And we also have this self-test kit that is on board that we are using even at AHF. And for the people who are very busy, they can't access health services, we encourage them to get tested at their own homes. And then if the results are positive, they can come to the hospital for a confirmatory test. It's just a screening test like the pregnancy test. Just to sum it up, everyone needs to be tested. Let's not dwell on one person's status.
Yes, and on the dwelling on one person's status, there are people out there, you find out that your partner is HIV positive, but luckily you are negative. Martin, let me ask you this. How is it possible to live with someone who is positive? Is it by God's grace that, you know what, I was lucky I could not get the disease? Or what exactly happens with our bodies that sometimes you could be living with someone who is positive for even years, but you end up testing negative?
Yeah, there are quite a number of things that can make that happen. And one, if the positive partner is on ARVs, we know that that person has undetectable viral loads, and therefore the chances of transmitting to the negative partner are very slim. So these days, you find that most couples who are in a discordant relationship stay like that for quite a while. Actually, even some of them may not get HIV altogether, unlike the days before where we used not to have ARVs for everybody. So these days you're finding the issues of discordancy also on the rise, because one, the positive partner is on ARV, so they are virally suppressed, and also we encourage the positive partner to always go for checkups together with the negative partner in the clinic at least once every 3 months, because also we do HIV testing for the negative partner every 3 months, so that, and also we continue counseling them on how to continue living positively for the positive partner, and also continue giving prevention messages to the couple. And apart from the ARVs that are critical in maintaining the discordancy, in the clinics we find we encourage them a lot to practice safe sex. So one of the things is that we encourage them to consistently use condoms, and also to ensure that they are faithful to only one partner. And also there's a package, a full package on how to go about a situation probably whereby discordant couples may want to get children. So there is some advice that they are told in the clinic, especially.
And they'll be breaking that down for us when you want to now get a baby.
Yeah.
But just before we get to disclosure and now the viral suppression, maybe Lillian, sometimes I've had so many testimonials where just a couple, maybe one person gets sick, they were never aware that one of the partners was positive, and they just walk into the clinic and they just find out this person, they have been living together, this person is positive, and this other person with no ARVs in question, and this other person is negative. Is it immunities to do with strong immunities, or how exactly does that happen?
Okay, we also have, he had earlier mentioned that there are genetical issues regarding that. We have these receptor cells. Someone might not have the correct, the type of cells that may attract the HIV virus. It's a virus, and it attached to these receptor cells. So at most times you get that. There's also a study that was a few years back, that these are female sex workers who used to practice unprotected sex, and they would go with people who are HIV positive, but they were never HIV. They never seroconverted to HIV. So it goes on for some time. The body does not detect the virus. The moment we test for HIV, we test for the antibody. Whenever there's a reaction in the body, there's this antibody that is produced by the body to fight this new infection. So that's what is tested for the HIV virus. So these people don't fight against the virus, and they later on come to seroconvert. They come to become HIV positive. So as he was trying to say, this is a few cases. We get a very few number of people who do not seroconvert, yet they are living with people who are HIV positive. They practice unprotected sex, and they just, I think it's genetical.
Just to add to what Lillian was saying, really, there are a lot of studies that are being done on that genetical, I'll call it genetical malformation, because we have so many congenital abnormalities under normal circumstances in people. You'll find somebody has been born with maybe only 4 digits, and when it comes to HIV receptor cells, we may find that someone has abnormal receptor cell genetically, so, and if the receptor cells are abnormal, then you will find the HIV is not able to attach and get into the CD4 cells, because the first point of entry of HIV is through the CD4 receptor cells and then into the CD4 cells. But apart from that also, it's good to know that when someone is exposed to HIV, our bodies have mechanisms to counteract any infection that comes our way, be it a virus, be it a bacteria. And first of all, you will find the virus will first of all have to penetrate through the mucous membranes or the broken skin. And also, especially when you're talking about now, when we're talking about the intimacy, if we're getting HIV through sex, one, the HIV has to navigate through the mucous membranes of the reproductive system that also has its own defenses. So it doesn't always mean that because somebody has been exposed to HIV, they will definitely get, because probably by the time it's navigating through the first layer of the mucous membranes, then the cells that fight infections can be able to clear that HIV. And also, even if it passes through the first the first membrane, then still after that, there are also very many other barriers before it reaches the blood and also the tissues. So in between exposure and the infection, your body also tries to fight back. So in some instances, you really actually don't get an infection per se. And there are quite a number of things also that may contribute to either you'll get an infection or not. And one of the major ones is the viral load, how much of the virus that you have been exposed to. And another thing, how is the consistency of the skin or the mucous membrane around the area of exposure. Another thing is, are you suffering from any other sexually transmitted disease, especially the ulcerative ones? You know, when you have ulcers, then it's easier for the HIV to get in. And also, how many times have you been exposed? The frequency, you know, yeah, and also the type of the HIV that you've been exposed to. So right. it's a big.
Let's talk about the exposure, because Lillian, I believe the exposure is the biggest deal why so many partners would transmit the virus to the other partners, not because they willingly want to, but they don't know how to disclose this to their partners. One, there's a lot of stigma. Many of them will fear, separation. They have kids, their kids in question. But how do you go about it? You found out you are positive. You're not sure whether your partner is positive. He or she may be negative, but now you want him or her to know that, you know what, I'm positive and I need to change 1, 2, 3, and 4. Do we have an ideal way of going about this? Okay,
for AIDS Healthcare Foundation, we have our counselors on board, whereby they are placed in our facilities, and we get that in most cases, couples work in as a couple and they live as single or separated because of the results in that room. So the counseling needs to be a bit intense, especially when you're dealing with couples. You don't know what the results will be, and in case one becomes aggressive, you need to separate the session. There's a way that we separate the session. We talk with one partner at a time. Just take us through some counseling session here, because now a couple has approached you because you are a HIV prevention nurse, and it's a partner actually who's approached you. They want to get to know how they are going to disclose their status to their other partner. And we also have, I was just getting to that point, we also have what we call assisted disclosure. I'm not supposed to disclose on the partner's behalf. He or she is supposed to disclose to the partner, but we have something we call assisted disclosure, whereby they walk in as a couple, and even if the lady knows her status or the wife knows her status, we pretend that they don't know. So we test them afresh as a new couple. And before we go through this session, we need a lot of pre-test counseling. We talk to them. We need to know what will happen in case these results come like this. Will you separate or will you support each other? So it's intense, and before testing the couples, we take them through a lot of counseling, and we book them for the next sessions. It's not a one-time thing. Disclosure is a process, and maybe we can start maybe the first day, and one partner just storms out. We need to book for another appointment for them to come on board again. So we assist the positive partner to disclose to the negative one. In that, we test both of them at the same time, and each one of them sees the other person's results. And after that, now we discuss what next. Yeah. Yes. All right. And now, Martin, one person, let's say they've agreed to support one another after the end of the counseling session. Yeah. Now you go back home. How do you live together? How do you ensure that you don't transmit the virus to your partner?
That actually needs a lot of commitment, especially from the positive partner. And it's always advisable that every time the couple is coming to the clinic, they have to come together, because the information that we give them, both of them have to implement. But I'll say most times the focus is usually on the positive partner, and the negative partner has to support this positive partner so that she can also continue remaining negative. And how to live at home, really, there isn't a very big difference between the HIV negative couples and the positive couples, for as long as the positive partner is doing what is required of him or her. And the most important of all is be on ARVs. Be on ARVs, practice the use of condoms, and get treatment in case you have any illness as soon as possible. But the most important of all is actually ARVs, because we know that the moment someone starts on ARVs, by the 3rd to the 6th month, the viral load is usually decreased to undetectable levels. But also good to mention that, especially for the newly tested couples, one in the discordant relationship, it's always important to give the negative partner PrEP. We have the pre-exposure prophylaxis that basically prevents the negative partner from getting HIV, and this one is usually given for as long as the partner who is positive has a detectable viral load. But again, remember, when someone gets tested like today, we expect that the viral load will be very, very high, because they have not had any intervention in terms of ARVs or anything. So that's why for any new discordant couple, the negative partner has to be on PrEP for at least 6 months, and until you do a viral load for the positive partner, and if it is undetectable, then the partner who is negative can stop the PrEP. So that's another way that actually is helping the negative partner to remain negative, and the positive partner also, to be virally suppressed and also live a very healthy life.
Yeah, and talking about viral suppression, Lillian, he's talking about initial stages, to be using protection. But then, how and when now do you begin planning for a baby, getting a baby? Let's say it's a couple that doesn't have a baby, they want to get more babies. At what stage now are they free to prepare for that?
Oh, so we normally take them through the viral load suppression. After the viral load is suppressed to low detectable levels, they can now, during the unsafe days for the lady, she can practice unprotected sex. In that, she can get pregnant, but the other days she uses condoms throughout. But for the unsafe days, only the unsafe days, she can now practice unprotected sex. Then, if she becomes pregnant, and let's say she needs to come to the clinic for the ANC antenatal care, and if at all she's HIV positive, we take her through the whole process up to 24 months. So that the baby can come out negative out of this whole process. And
what if it's a man who is HIV positive and the lady is okay?
So if it's a man who is HIV positive and the lady is okay, the lady will be tested just like the other ladies who go through the antenatal care for the first visit, and again she'll be tested the 3rd visit and during delivery. Then after that, she'll be tested again during 6 weeks when she's coming for the baby to get the immunization. So it's just normal like the other ladies, nothing much to worry about.
My point is, because you said for a lady, if the lady is HIV positive, then only during the unsafe days they can practice unprotected sex. How about if it's the man who is HIV positive and they want to get a baby? Do they also look at the safe and unsafe days?
Yes.
Yeah.
They still look at that, because even if it's the man who is HIV positive, you said if the man is HIV positive, the lady is negative, right. They still look at the unsafe days, because there is a high chance of this man infecting the lady, even if she gets pregnant. So they'll still practice protected sex. All the discordant couples, we preach that they need to use condoms, and the negative partner needs to take PrEP. So they're using condoms all through. And unless they want to get a baby, now they'll come for the counseling sessions, and we teach them how to practice unsafe sex only when the lady is unsafe, not when she wants to conceive.
All right, I know you're not menstrual experts, but for ladies, it's some people don't really get to understand safe and unsafe days. Okay. So it becomes For me, I think it can become a challenge with that. Do you also have some counseling sessions for determining unsafe and safe days for women?
In our clinics we have comprehensive care, and in comprehensive care we also have family planning as one of our set departments, and we have these beads that we normally teach our mothers on how to count the safe and unsafe days. It really depends on your cycle. If the cycle is longer than 28 days, there's a way the beads are, you count, and every day you need to push and you count them. And the beads, which they are different colors. So it's like a session, and we teach them all through on when you're unsafe and when you're safe. So it depends with your cycle, and also a lot of things, hormonal imbalances, if you've been on family planning, if you've never been on family planning. We have those services in our facilities.
All right, and Martin, now still on the planning to getting a baby, what are the chances of HIV? Because some men or women, some partners will be paranoid about it. Come on, I'm going to have unprotected sex with my partner whom I know is HIV positive, but at the same time we're planning to have a baby. What are because we need to convince our viewers out there, especially people in such situations, what are the chances of HIV transmission, especially when you're trying to get a baby during that period that Lillian is saying, unsafe days for women? Now you're trying to have unprotected sex. As a man and as a woman, how safe I am at that particular time?
What I'll say is, I think I'll start from what we had talked about earlier about ways of transmission and how big is the risk. So one, we very well know that a partner who is very suppressed, actually, as I will say, an insignificant chance of transmitting to the partner who is HIV negative. So I'll handle that in two aspects. If the lady is the one who is positive, and if the man is the one who is positive. Right. So for the lady, if the lady who is positive, apart from what my colleague has said, I know it's a controversial topic, but it's also good to discuss when we're talking about family matters here. Okay. That we are not telling the discordant couples that they should not be intimate. The only thing we are saying is they can continue being intimate, but on those the days that the lady is ovulating, actually 2 to 3 days before the ovulation period, and as Lillian has said, there is a way use those beads. Also, other methods that you can tell whether the lady is ovulating or not, including the increase in body temperature at a particular point, and also sometimes we'll find some clear cervical mucus sometimes during that period. So those are some of the things that we tell them to look at and know that they are ovulating. So, and we advise, especially when the lady is the one who is negative. The controversial topic I was talking about is where one can do actually self-insemination. You will find the guy will have the lady will self-inseminate, because now one, we know that the guy is not positive, and so by the lady self-inseminating means that the man is at no risk of getting HIV. But again, if it is the lady, the man who is positive, then the other factors that we were discussing earlier still continues, and one of the most important ones is actually being on PrEP. The lady has to be on PrEP, and the man has to be very suppressed. If you combine a very suppressed man and a lady who is negative on PrEP, then actually I'm yet to see a case of a person who is positive and having done all that. So it's not very easy if the couple really does what the doctor has advised them to do. Again, there needs to be a lot of understanding also. And one of the things that I find in families is, especially for the affected partner, they need a lot of support from the negative partner, because you see, there is a lot of emotions involved in such a situation. Situations that would otherwise warrant increase in emotions in the family, during those differences. Sometimes how the negative partner handles that situation really matters. And you know, we have some people who may throw in HIV in their discussion, and we really discourage that a lot, because you know it eats on the positive partner's ego and emotions, and at the end of the day we will find that at some point, if it continues like that, then the reaction, they become too defensive, and then even sometimes they get violent if it is perceived. So the negative partner has a very big role to play when it comes to supporting the positive partner, and so now the positive partner can ensure that the negative partner continues being negative.
Right, and someone may be saying that's a very hectic process or journey to put yourself in. That's why most people opt to separate. But how expensive is this journey in terms of the treatment? I know the ARVs are free of charge, but there is also a lifestyle change that is in question here. So how expensive, how tedious? Because some people will be like, no, I can't do all this. we'd rather separate. People could even voluntarily say, yes, I'm the one who's positive, but I can't put you through this. You know, how is the journey like?
I wouldn't say the journey is expensive, because nothing changes even for the HIV positive client, in that they're getting the drugs for free. The drugs, if the drugs were being sold, that would be another case, because it would be damn too expensive for them. But I could say that they're getting the drugs for free, and in our clinics, as I was saying earlier, we're all over Nairobi, and our services are totally free, both family planning and counseling. Anything that you feel maybe your emotions are getting way out, you might visit our facilities at any point and get free counseling services, of which other places you might be charged. So I'd say the journey is not easy, especially for new couples who are, one is positive and the other is negative, because at fear of unknown, you don't know what you expect. You don't know if you'll get kids and they'll be HIV negative. And what I could just advise our listeners is that in case you get your partner is HIV positive and you're negative, you're the one who will play a bigger role in the support, in everything, in reminding them to take their drugs, and feeding part of it. Nutrition is a major part of it, because when you don't feed well, we say your immunity is attacked and you can get these opportunistic infections. And you can also take your medication, the PrEP, also in our facilities they are free. And the negative partner has a bigger role in this journey, in supporting the positive one, planning, reminding them to take their drugs, doing what the doctors advise them to do, and everything. Within time, they come back and tell us, we used to fear nothing, because we are doing quite well. My partner is HIV positive, I'm negative, but they even come to pick drugs at some point for them. We see that now they are getting on well. So the counseling plays a bigger role, because it's all psychological, and I think when we give good counseling and we keep on calling them, give them good follow-up, everything flows well.
Right.
Yeah, and they come back really doing well. Yeah.
And Martin, how well or bad are we doing as a country in regard to appreciating discordancy?
I think there is a very big change. If you look like for the last 5 years, there's a very big shift. As I said earlier, you would find the negative partner during those times, the rates of seroconversion to being positive was higher than now. And one of the main reasons as to why that has decreased is because these days, the moment someone knows that they're HIV positive, they're started on ARVs immediately. That means that at the end of the day, their viral load will start being suppressed from day one. And also, these days, apart from the ARVs, we encourage the positive partner to bring all the other sexual partners that they have, because as we know, someone could be having probably a wife, but then also has other extramarital affairs. So we also encourage them to bring even those others, for testing as well. And the moment we find that there is HIV positive, then we link them to care immediately. We don't need to wait. But if you look at 5 years ago, it was totally different. I remember when I was very new in this profession, we used to give ARVs when someone's immunity has gone down to around 250. And by the time the immunity is going down to 250, then it means the viral load of this positive partner is so high and the person is very, very infectious. But these days, it's totally different, because the moment someone knows about the HIV status, we put on ARVs and also bring the other family members on board, including the children in that family, especially those who are less than 14 years. And therefore, you find interventions these days are quite fast and quick, and they are being shown to be very effective, unlike years back. And again, if you remember well, some times back, even the way the information about HIV was being packaged, even when I was a kid, I used to really fear HIV a lot, because one of the things is that in the billboards you could see drawings of very skinny people, very thin, and then even the messaging itself was not really very good. But these days we know that you can be HIV positive, you can live a positive life, and again we're demystifying a lot of myths that used to be there before. Because I've heard about many people talking about the ways of getting HIV that actually are not true. So people these days are very much informed, because we're having very candid discussions about HIV and prevention and how one can get. And that's actually a plus, because it even makes the negative person in such a relationship be empowered also, having the correct information. Because otherwise, if we don't give that information, then they get the wrong information from the community. And also these days, apart from me as back, also engaging the community a lot, including the gatekeepers in the community. That includes the chiefs. So we're having health education to the communities. Also, we encourage the preachers and the churches also. But I still feel that there's a lot of room for improvement, especially in the churches, because these are very good forums that we could sell HIV information, demystify, the needs that people have. And so we are not yet there, but I think we have really made strides.